Hey, good evening, everyone, once again, and thank you for taking time out and joining us today on SKINQ Talks. Today, we're going to focus about pigmentation and how to treat pigmentation. Our speaker today is Dr. Chytra. Just to give you a quick introduction about Dr. Chytra, Dr. Chytra is the founder and chief formulator at SKINQ. She's the founder of Cosmoderma Clinics, a very well-known chain of clinics based out of Bangalore, Chennai, and Delhi. She's also popularly known as the Indian beauty guru. So introducing you all to Doc. Doc, thank you so much for joining us this evening. We know you've been a little unwell, so really grateful that you could take time out to be part of today's session.
Thank you so much, Disha. It's a pleasure to be here. Good evening, everyone. Happy to be here today. So, Disha, we're talking about hyperpigmentation today?
Yes, Doc, we are. So, Doc, I was just actually reading up about pigmentation just before this session, and I came across this write-up that said, about 80% of Indians face pigmentation as an issue at some point in time, during their lifetime. And I've heard even with just people I know, a lot of them saying that, I have pigmentation, I have dark patches, brown spots, and all of that. So I just wanted to understand, help us understand what is pigmentation, and are all of these the same concern? Does pigmentation also mean brown spots and dark patches?
Got it. Great question, Disha. It is true. Indians, right, as such, we already have skin of color, as we call it, because our skin already has some amount of color in it. So we're all different shades of browns to blacks in our Indian skin type. So that means that already we're pigmented by nature. That's our natural skin type. But 80, you said 80, but it's actually more like 90% of Indians are prone to hyperpigmentation. It's known that 90% of Indian women will get hyperpigmentation at some point in their life, and around 20% of men will experience this hyperpigmentation, right? But in hyperpigmentation, there are various different things. We've got something as small as a mark from an acne, or somebody falls down and gets hurt. The way they heal and recover in Indian skin is that normally the wound will heal, then it'll form like a little brown patch, and that brown patch takes forever to heal. It's the same with acne. It's the same with any kind of wound, burns, a small cut, a scrape by falling down, etc. Along those lines is one side of pigmentation. The other side of pigmentation is where we have hormonal imbalances that happen. Now, typically women are prone to this, right? Because of the changes in the estrogen and testosterone. So that's called melasma. So 90% of women will get melasma in their life and stuff. And then we have the most common of all the pigmentation, which is a photomelanosis or sun damage pigmentation. Like a lot of people get tanned, right? And tanning is not a bad thing, as in like, oh, don't get tan because you're going to get darker, but don't get tan because when we get tanned, the color of the skin gets darker, sure. But what does it mean? It means that the skin has undergone a chemical damage. It's the way that your skin reacts to any damage, because Indian skin reacts to damage by hyperpigmentation. And a tan, when you increase your skin color, is a way of your skin saying that I've gotten damaged by the sun, and it's protecting itself by increasing the cell production. That means the skin cells, and for every 9 to 10 skin cells that we have one pigment cell. So as the skin cell increases, the pigment cell also increases. As this happens, eventually over a period of time, the pigmentation adds up, and this will lead to hyperpigmentation. So there's so many reasons that we get all of this. And another common one, that not common, more uncommon, is drug reaction, right? Like a lot of people take medicines, they don't realize it, but something like taking a paracetamol commonly or some antibiotics can actually make our skin get darker. The other one, pigmentation, which people don't realize, right, but they do get this often in Indian skin specifically, is because of constant damage maybe pre-diabetes in their body, insulin resistance, or if they're on the side of obesity, inactivity. So they can get a lichenoid reaction. They can get something called acanthosis, where the skin thickens. Then people see this around the necklines. They see it in the underarm area. They see it in like between the inner thigh and stuff like that, where there's thickened skin and then there's darker colors. And then we also see this around this area, like men, right, Disha, commonly see pigmentation in this area, and women tend to see it in this area. Young girls tend to see it around their lip area. And so these are various different kinds of pigmentation that we have.
All right. So, Doc, actually, when we opened up registrations for this masterclass, we asked a lot of people, what is the one thing that you want addressed from Dr. Chytra? And most of them said, two questions that they had. One of it was, how can we prevent pigmentation? And the second one is, if you've got pigmentation, what is the cure for it? So I think we could get started. I think most people are very curious to know how we could probably prevent pigmentation altogether. Is that even possible?
That is the best way to cure pigmentation, by not getting it in the first place. So today, pigmentation has no cure per se, right? You can reduce the marks, you can clear some of the marks away, which the dark marks can clear. But the marks which look really faded and very light, maybe we may not be able to clear, because that's deeper in the skin. So with that, we always tell people that in pigmentation, the best thing is protection is better than cure. And it holds good here. And the way to protect it is, like 99% of the cause for pigmentation is sun damage. People don't realize it. They say, I don't go out into the sun, I'm never in the sun, everything. But the truth of the matter is, if you're sitting indoors and there's light coming in through the door, that's enough to damage you. And that damage leads to accumulation over time, which leads to hyperpigmentation. So even if one is sitting inside the house and they're not stepping out at all, and if there's daylight coming through the door, they must use a sunscreen. The only way to protect ourselves from hyperpigmentation is to use a sunscreen regularly on a daily basis. And that doesn't mean that you just put like any random sunscreen. What is critical to understand is the level of activity of a sunscreen, and that's not tied to the SPF, right? SPF, people think a higher number means higher protection, but that's not true at all. With the SPF, what happens is we need a minimum of 30 to 40 on a daily basis, right? Anywhere in this range is fine, because the difference between a 30 to a 40 to 50 is like 0.1 to 0.2. It's actually quite negligible. Like you get about a 96% at 30, 96.5, 97% at 40, and 97 point maybe 2% at 50. But beyond that, you don't get any extra boost by using SPF 100. But what happens is, to that sunscreen, what else is added? So when we are choosing a sunscreen, I know that this was probably going to be one of your questions, but because you asked me about protection, I want to talk about it. The only way to protect our skin is to protect from sun damage, which means protect it with a sunscreen regularly. And for that, you look at a sunscreen that has broad spectrum activity, because you have the UVA light and then you have the UVB light. So you want to protect against both of this, the UVA and the UVB. And along with that, you need to have something that's called the PA factor, right? So there's ratings plus, 3 pluses or 4 pluses, etc. So you need a SPF and you need a plus PA rating plus a broad spectrum activity. That is the ideal sunscreen for baseline. Then if it's blended with an antioxidant like a vitamin C, because there's no other photoprotective antioxidant. Only vitamin C is the photoprotective antioxidant, and ferulic acid to a certain level. Vitamin E, D, hyaluronic acid, none of them are photoprotective, okay? They're skin conditioning. So vitamin C is a photoprotective antioxidant that is highly potent. And when that's blended into a sunscreen, it makes the sunscreen not only reduce your sun damage, but also start repairing it right away. So that's what's critical. So that's the only way to protect ourselves from the pigmentation, by sunscreen. So prevention. And you can start sunscreen for a baby as young as 6 months old. That's the age to start sunscreen at. And then go on. And application is at least once 20 minutes before you're exposed to the sun. So typically you put it on in the morning and then after your shower, kind of thing. And then reapply if you're going to be outdoors, right? After about 4 to 5 hours, reapply your sunscreen. That's typically how you do it.
Okay. So doc, say we've used our sunscreen, but we've still, managed to get some bit of, sun damage or a tan or pigmentation. Then what do we do?
Well, then what's critical is to get rid of the tan as soon as possible. The reason is when the tan is on the skin, it's a sign that there's been damage on the skin, like chemical damage. But if you leave the pigmentation in your skin for a long time, then that pigmentation will end up the tan will end up causing hyperpigmentation for a long time. So it's very, very important to get rid of the tan as soon as possible. Now, how do we get rid of the tan? So the tan, when it happens, if this is the skin, right, on the surface, the sun hits us. The skin has the upper layer and then it has a bottom layer. Now, in the upper layer, there are 5 layers itself, in the top layer of the skin, and the bottom layer has another 2. Each of these 5 layers have about 20 layers of cells within them. So overall, just the upper layer of our skin has about 80 to 100 cell layers. Now, when we get a tan, it means the bottomest layer of the upper part, the 5th layer in the upper part, has triggered a irritability or an irritation, inflammation reaction. The skin cells are producing more pigment. Okay, so it needs to come from there till the top, which is a 28-day process. Okay, because our skin naturally exfoliates itself every 28 days. That's called the skin cycle or skin cycle renewal. Now, if we let it be for 28 days like that, if it's just a superficial tan, it'll come off eventually. But repeatedly, when this keeps happening, our skin cells is also our body's first immune barrier. So it recognizes this as being foreign to our body or alien, because you're not supposed to have that many pigments in our skin naturally, right? The extra pigment. So it'll start reacting to it as though it's a foreign body. And when that happens, it captures it, makes an envelope around it, and pushes it deeper into the cell rather than throwing it out of the skin. That's when it all collects like little blobs and forms a sheet or a patch of hyperpigmentation. That's exactly how hyperpigmentation develops. So when we do a tan removal, we're talking about using chemical or active exfoliants, right? In a clinic, we would do chemical peels, but at home you would do active exfoliation and mask. Not just exfoliate, but you have to use a mask after the exfoliation. Extremely critical. So we would use mainly for tan removal something like a glycolic acid or a malic acid, lactic acid. These are the 3 that are actually suitable for tan removal. Along with that, you want to accelerate the cell process and suppress the inflammation. So you'd use anti-inflammatory like vitamin C. You would use niacinamide in there. So like I think something like our Glow Bright mask, right? The SKINQ Glow Bright mask was really made for that, for the tan removal, because it's now clinically trialed and proven to remove tan by 85% in one session in 15 minutes. And the reason Disha, we did that Glow Bright mask was because everybody was using so many exfoliants on their skin and they would just walk out, right? They would just exfoliate and walk out. And after a few months, we would see more pigmentation patches on their skin because they'd left their skin naked to more damage, right? One is the sun, then it's the pollution and everything. So we realized that we need to make them put a mask on, and people just don't have time or patience. So we introduce the acids into the actives into the mask, and that makes it an active mask. So 15 minutes detan. So that's very critical. Now, in some people who already have hyperpigmentation, if they're getting tan repeatedly, they should use like pigment suppressant lotions or serums or creams, right? The reason is already when your skin has hyperpigmentation, it means that your skin is already sensitized and irritated. So a little bit more extra pigment is not just a little bit more, but it's amplified. So a little bit more adds on to this big blob of irritation. So you need to suppress the hyperactivity, not the normal activity, but the hyperactivity of the pigment cells need to be suppressed. And that can happen with pigment suppressants like licorice, arbutin, kojic acid, etc. So that's something that we put into our glow serum or the T-tan serum for long-term improvement of tan and for improving the hyperpigmentation, right? So today the D-tan serum or elixir, as it's known, is in 28 days, it clears hyperpigmentation patches by about 38%. And that's amazing to get rid of pigmentation from the bottom to the top in 28 days. So you're doing it with a cell renewal. So it's so complex. It's like a universe of pigments and blobs and inflammation and irritation. But that's why we say that, somebody who finds a cure, forget billionaire, they'll be like a zillionaire, because there's no cure for hyperpigmentation, but we can definitely reduce it, we can make the skin look better, and we can definitely prevent it from happening.
Great. So it's really great to know, Doc, that we have some remedies that we can do in the comfort of our home and take control of our pigmentation. I just wanted to ask you, you mentioned that SKINQ has a range of products that have a lot of active ingredients in them, like what you mentioned, glycolic acid, malic acid, kojic acid, a bunch of ingredients. Are these ingredients safe to use, and can they be used by people in the comfort of their home, and how often can you use these without it adversely affecting your skin, if it does adversely affect your skin?
Great question. So the thing is, too much of anything can harm us, right? Same thing with good skincare or bad skincare or whatever. Anything in excess is damaging. The criticality here is to understand how to fit it into our skincare routine. It's great, like you see an advertisement or you see something and you're like, I'm gonna go and use this active, it looks amazing. Sure, but is your skin prepared for it, right? Because the moment you start using active skincare, you need to be able to protect it, because you need to be able to create the sealant in your skin. If your skin barrier is not maintained, the skin can get damaged further with active skincare. So what we did at SKINQ when we were doing that, we realized, I mean, you've been with me from when I was ideating this too, no, right, Disha? So that, the whole idea was people were getting so many burns from using skincare or pigmentation issues and walking into our clinics asking for solutions. And they would like go online, buy steroid creams, use it, and that's so many issues. So the whole idea was to do safe products for Indian skin specifically. So at SKINQ, our products undergo clinical trials, plus they are made safe certified, which means it's deemed safe and harmful, free of harmful toxins, etc. And more importantly, it's formulated for Indian skin and skin of color, because the way our skin reacts is very different from other skin types. Like if you have a friend who is Caucasian, like European or something, right? If they go in the sun, they'll get a little red and stuff. But we would have tanned. Next day you come out, we would have been a shade darker and they would have come back to their normal shade, mostly maybe a little pinkish. Stuff like that. Just the way our skin reacts to things is very different. So those nuances are critical in our skincare. Now, everybody can use actives, okay? Actives is just a term for skincare that actually has efficacy, which means it can do something that can help heal, repair, any of those. But where does it step into your skincare? And I always say this, skincare is absolutely easy and simple. Just remember that there's 5 steps to it, right? There's a cleansing routine where you always cleanse your skin, and you cleanse it with a pH balanced or a soap-free cleanser. The reason is our skin is naturally acidic and you want to maintain this acidity in our skin. So to do that, excuse me, to do that, it's important that we make sure that we maintain the acidity of our skin using a pH balanced cleanser, not soap. Second, after that is nourishment, right? You want to nourish the skin. Nourishment to the skin is like ceramides, squalene, hyaluronic acid, shea butter, sodium hyaluronate, vitamin E, mango butter, etc. It's like food for the skin. And that's your moisturizing step, literally. But just a regular moisturizer is good if you have just regular healthy skin. But if your skin is troubled or if your skin is sensitive, that means your skin natural barrier, which sits here just under the visible skin, is damaged. And when the skin barrier is damaged, the skin is not able to repair itself. And if the skin can't repair itself, it dehydrates, it gets drier, and it's not able to heal itself. So it'll start pigmenting. It's a vicious cycle. So using a ceramide-based moisturizer, once you're over the age of 25, is critical. Till 25, our skin is fabulous. Like even if we have acne, whatever problems, till 25, it will regenerate and rejuvenate itself. But once we hit 25, the growth spurt stops, then the skin gets into concerns and issues. Okay, so this is one aspect to it. Now, the second thing, what happens after? That's step number 2, right? Nourishment. Step number 3 is protection. And we already spoke about it. It's a sunscreen, right? And there is no sunscreen in, there was no sunscreen when we started formulating, because everybody's problem with sunscreen is that it's greasy, it's sticky, it's oily, and it leaves a ghosty appearance and all of that. And of course, we all tan with sunscreen. So why are we wearing a sunscreen? So the whole idea behind the Sun Protect Gel at SKINQ was to infuse an antioxidant to not only improve the texture of the sunscreen, so it's textureless, but also to reduce the tanning the moment we get that. So there's vitamin C in our sunscreen. So the moment the sun hits us, the vitamin C will start working to negate the irritability, right? So there's less tanning. And the sunscreen is, Sun Protect Gel is textureless. It's a gel, but it feels like a lotion. It's super thin. It's color agnostic. It means however fair you are or however dark you are, it leaves no shade, no tone, no gray hue, no stickiness. So that's the sunscreen step. Step number 3. So cleansing, nourishment, and protection. Then comes what we call as a repair, right? Repair or the treatment aspect of it. That's where you use actives in your skincare to take care of something that's a problem. Like if you have acne, you use actives for acne. You have pigmentation, you use actives for pigmentation. You have dry, dehydrated, sensitive skin, you use actives for that, right? So based on your skin condition, you will use the actives. The actives can range all the way from acids like alpha hydroxy, beta hydroxy acids, as we call them, the glycolics, malic, lactic, salicylic. It can be niacinamide, it can be hyaluronic acid, sodium hyaluronate, licorice, kojic acid, azelaic acid, arbutin, retinol. There's so many, right? So all of these are actives. So you choose the actives that is needed for your skin at that time. Now, what I don't understand is how people are getting so like gimmicky by one single active serums. It makes no sense. I mean, just using a niacinamide on its own, or just using a vitamin C on its own, or just using a vitamin E on its own is not going to help the skin, because the skin has multiple layers to it. So you need to use a serum that will work on the different aspects, right? So let's say we're talking pigmentation today. So if we're talking pigmentation today, what do we need? We need something that will increase the cell turnover, so the pigment at the bottom can come up to the top. So that would be your alpha hydroxy acids, okay? We don't use salicylic acid for pigment, so we use like glycolic and malic acid typically. Next, you want something to suppress the pigment, right? So you're using a kojic acid, a licorice, or arbutin in that area, right? Third, you want a little bit of antioxidants to start repairing the inflammatory steps. So like gooseberry extracts, and you can have like vitamin E, vitamin C, etc. Then, or you can have niacinamide, right? So you want a combination of these to treat pigmentation. Just using a glycolic AHA BHA solution, or just using a kojic acid serum, or just using like a arbutin licorice serum or just using a niacinamide on its own is not sufficient. You need a combination of this, because you need to increase the cell turnover, you need to suppress the pigmentation, and you need to take down the inflammation. You need to increase the antioxidant activity. So that will be the three things that you have to think of when you are doing hyperpigmentation treatment. So that's a multi-active hypertensive serum that you would use. And if the pigmentation is of chronic type, that means it's been there for a long time. Prescription, like as a dermatologist, we're always prescribing medicines, right? We need to prescribe something much, much stronger, which can actually go even to the deepest layer of our skin and work from within and come out. Then comes the last step, right? So we've talked about cleansing, we've talked about protection, we've talked about nourishment, we've talked about the fifth step. Those are the daily 4 steps. Okay. Every day, these are our 4 steps. Fifth step is called boost, because we need to boost our skin health. Like I told you, till 25, skin does great. But after 25, it starts going downhill because we stop producing growth hormone in our body. So when that happens, we need to keep that skin cell renewal going, right? And if it's renewing every 28 days, it'll become 30 days, 31, 32 days. People say, why? It doesn't matter. It does. When the life cycle is only 28, if you're increasing it to 30, the skin starts getting open pores. It starts looking dull. That's when people say, there's no glow, there's no radiance, my skin feels sensitive, it's unhealthy. That's because the skin cell renewal is not happening. So that's why you need to boost the skin health. And so that becomes your active exfoliation and masking, right? So that's where our masks sit in. Active series for exfoliation and mask. If you just exfoliate, no good. You got to exfoliate and mask so that you close that skin pore right away. Clay mask, sheet masks don't count. You may as well just take cotton, dip it in nice rose water or water and put it on your face. That's equivalent to a sheet mask because your skin has a natural skin barrier on the surface. Nothing penetrates it other than actives, right? Actives that to the right proportion, right pH, etc. So when you put a sheet mask, it's on the surface, it feels nice and cooling and hydrating, but it's great for that. But it's not going to work on treatment aspect. Okay. So this is the 5-step routine that people need to follow. And 4 is a daily step. So that's all we need. We don't need 10-step, 20-step and all of that. By doing that, people can protect themselves and help treat their pigmentation.
Okay, great. That was really helpful, Dr. Chytra. Thank you. For all those people who are dropping in questions, we will open up the session in a couple of minutes. So keep those questions coming. You can either, put out your questions in the chat or wait it out, and we'll open up the session as well to you all. So Doc, just wanted to check, you mentioned again about the active ingredients, the combination of active ingredients. You've given us a skincare routine to follow now. How soon can we expect results? So if someone has pigmentation, I caught on to something very interesting where you said 28 days when you were talking about the serum that SKINQ has. Why 28 days, and how soon can someone expect results when they're treating their pigmentation?
So it depends on the kind of pigmentation. And I'm glad you asked this because today it's the world of instant, right? Everybody wants an instant fix. So the only thing that gets instantly removed is a tan. Okay. Pigmentation comes from the inner cell. It can't be removed instantly. It takes 28 days to get it out because that's the cell cycle, renewal cycle. But immediately your skin can look glowy. It can look great, radiant. It can look brighter. It can look less tanned with a tan removal. But for pigmentation to come down, minimum of 28 days is required if you're using prescriptive skincare or high-potency multi-active skincare. If you're using regular skincare, it'll take about 6 to 8 weeks to start seeing a difference. Will it make a huge difference in the long run? No, because pigmentation is very scurdy and it doesn't respond that well if you don't use the appropriate actives. So when we're doing pigmentation, we always say 28 days. And that was the concept behind the D-Tan serum, right? When you use a D-Tan elixir, the Glow Elixir serum, you will start seeing the difference in under a week on the skin because the skin gets softer, smoother, and glowier. But it's not going to lighten your skin patch for at least 14 days. At 14 days, you start seeing a little bit of a visible difference on the patch. And by 28 days, you get pigment clearance by almost 37%. And that is clinically proven, like clinical trial proven, not just like people felt I look better. I felt it looks brighter. It's actually proven through clinical trials, which are drug level trials. And so that's how It is. But as a dermatologist, I always tell my patients, right? Minimum 3 months. That's how long you have to use a skincare product when you have any kind of issue. If you're treating something, it could be acne, pigmentation, dry skin, dehydrated skin. It is a minimum of 3 months that your skin needs, because the upper skin cell is 28 days, but the lower skin, right? Upper is the epidermis, lower is the dermis. Upper is 28 days, but the lower skin is 90-day renewal system. So you need to treat something for at least 90 days for it to be effective. But if you don't see results in under 28 days, then that's not working for you.
Okay, all right. And Doc, my last question to you when it comes to pigmentation, and then we'll open up, the session to the audience. I know you're someone who always says, healthy on the inside, beautiful on the outside. So you've kind of pretty much told us what we can do in terms of products, in terms of a skincare routine, if we have pigmentation or any sort of skin concerns. Is there any particular diet or anything that we should follow in terms of treating pigmentation or just avoiding pigmentation and for skin health in general?
Good question. Definitely, inner health really matters. Sorry. Inner health really matters. And the reason is the skin is our first immune barrier. It's also the largest organ in our body. And the skin is a reflection of what happens on the inside. Like I was telling you, if somebody gets pigmentation around their mouth and lip area here, for us, we know that that person already has a hormone imbalance related to their estrogen and testosterone. So that's a sign for us. If somebody's getting pigmentation here, we know that they're getting it because of sun damage and their life exposure. Someone starts getting dark circles here, we look at their iron, their folic acid, their vitamin B complex, vitamin D, and zinc. So a lot of this reflection of what happens in our inside is reflected on the outside. So if we're not healthy, that means doesn't matter how great your creams are, how amazing the skincare products are, as long as you use it, you're going to look fabulous. But when you stop, you've not really corrected the inner deficiencies. So what does that mean? It means we need to make sure that we have enough iron in our diet, right? And iron comes from like palak, pomegranate, and all of these things. But because Indians are generally vegetarian, a large proportion of our diet is vegetarian, we need to be careful that we get enough protein, because our skin cells make this waterproof sheet on our skin, which is called keratin. And that's a protein molecule. And if you're protein deficient, again, our skin texture goes down, our skin looks cracked, it can't repair itself. So one is iron, the second one is protein. Third is the vitamin family. So vitamin B complex, which is very critical, because all the nerve endings which cause stimulation require vitamin B complex. So do the pigment cells. But most important vitamin is the vitamin D. Most people don't realize this, but vitamin D is more critical than a vitamin C or D for our skin, because any skin process that happens requires vitamin D to make that process happen. Skin healing, repair, skin new cell production, everything requires vitamin D. And vitamin D also controls our hormones to a large extent. So it's important to have that. Then vitamin E for nourishment, for hydration, because vitamin E is an oily vitamin which helps with the oiliness in our skin, right? And so we would get drier if we had less vitamin E. Vitamin C for the immunity, because skin is the first immune barrier. You need the vitamin C to help make it strong and robust in its immune response. Then we need micro minerals, right? And trace elements. So we need magnesium. And people don't realize it, but none of us make magnesium. It comes through the food source. So if we're not healthy in our diet, we won't have magnesium. If we don't have magnesium, skin cannot repair itself. It's not just skin, our brain cells, our organ cells, none of it can repair itself. So it's very important to know that you need magnesium. Then along with these, we need zinc. All right. So zinc is another trace element or a mineral that's important for healing of our body. So these are some of the important nutritional aspects that's very critical for us, for our inner health. People don't think about it till something really shows up, and then they go do a blood test and they find that they're so deficient in it. And I want to tell there's something, like we all have to do vitamin D supplementation. The reason is 85% of Indians don't produce enough vitamin D. It's not because we don't get sun exposure, it's just that we don't have the enzyme that produces the vitamin D in our body. So we need to take the vitamin D supplementation. Then the next thing is, along with this, hydration, right? So that's water, and water is the life source for our body, and over 95% of the water that our body uses is stored in our skin cells as hyaluronic acid. So naturally we have hyaluronic acid which stores, they're like little blobs, and when they have water they expand, when they don't they shrink. Oh, so sorry. Sorry, that was me. I think it got paused. 1 second.
No, you're here, Doc. We can see you.
Oh, okay. 1 second. I can't see you guys. My screen just went blank because I think I got a FaceTime call or something like that. Give me a moment. Let me just get that in. Okay, got it. Yeah, so this is typically what happens, right? And so this is how the whole thing plays out in terms of our skin. So hydration, how much hydration? It really is a minimum of 1.5 liters to 2 liters of water per day. 1.5 liters is the most minimum if you're like 45 to 50 kilos. But after 50 kilos, for every 5 kilos, you need to add another 100 ml to 200 ml, 100 to 200 ml of water. So from 100, from 50, if you're 60 kilos, you need at least 2 liters, and 60 kilos and above, you know, 2.5 liters if you are 70 kilos. That's how you have to calculate the water. And just instead of just water, we're fortunate enough that we live in India and we can all have coconut water, because electrolytes, that's the other thing that's important for us in our skin. So having electrolytes is very, very critical. So ensure that you have enough electrolytes.
Okay, great. Thank you, Doc. Since it's 7:45 already, so I'm just going to jump into the questions that everyone has. So Sneha here has a question about how to treat pigmentation, which is on the sides of the forehead. And she also has a question about SKINQ products. She says, is your sunscreen and vitamin C helpful? And what is the procedure you were talking about, which is, 15 minutes in one session? So I think she's talking about the Glow Bright mask there.
Got it. Okay, Sneha. So if you have pigmentation on the sides of your forehead, that is what we call as photomelanosis. It's come from long-term sun damage. Not that something happened in the last 1 year. It's what's been happening in the last 10 to 15 years of your life. A lot of the damage comes because we were in our teenage years out and about in the sun, didn't protect our skin, and that reflects in our late 20s and 30s and so on and so forth. So what should you do now? Yes, the vitamin C sunscreen is extremely efficacious. It's clinically proven to reduce tanning by 15% on a daily basis when you use it on a daily basis. So please do consider using that. We've been top 5 at Vogue and top 4 at Elle Beauty Awards. So it's really a sunscreen that is worth trying. Second, the mask that I spoke about, the 15-minute, is the Glow Bright mask treatment. It's a mask that is infused with actives, and it has over 8 actives actually, all for brightening of the skin and superficial exfoliation of the skin. So you apply it, leave it on for 15 minutes, and then you wipe it off with a wet cloth. The reason is it's a thick mask because it's a exfoliation plus a mask closing. And what this does is it helps remove the surface tan. And if you have the pigmentation that you're talking about on the side of the forehead, you could apply it on your pigmentation patch 2 times a week for 15 minutes and wash it off. It'll, in the long run, dull out the pigmentation there. The third thing you can do is use the D10 Elixir Serum, which is the D10 or Glow Elixir Serum, which is a hypertensive multi-active serum for hyperpigmentation. Apply it on that area or the entire face on a daily basis, but don't forget to use a ceramide based moisturizer after, like the moisture balm, because anytime you use actives on your skin, you must restore the skin barrier with ceramide. Otherwise, it's not safe for the skin. So if you can do this routine, in 4 weeks, you'll see a difference. And in 3 months, your pigmentation will be vastly reduced. There are procedures that we offer at the clinics too. So we do chemical peels, we do fractionated lasers typically for this. And you should get about a 70-80% clearance on your pigmentation in 3 months.
And this was another question, Doc, about dark circles. I think a lot of people had written into us about dark circles. So, does dark circles count as pigmentation? And if yes, what can they do to kind of reduce it? And there's a particular inquiry that's come in here that says that, they say that they have more pigmentation on the upper eyelid than the lower one. So, what can be done about that?
Got it. So dark circles are of different, actually four types. There's one which is the pigmented dark circle where you see the brown ones, like a brown patch under the eye, sometimes upper eyelid or the whole eye. Then we
Mhm.
have something called the red pigment, which is inflammatory, has to do with people with sinusitis, migraines, and allergies. They tend to get like a reddish, purplish pigmentation. We call this vascular. Then the third type is what we call as structural. In structural, there's a sunken hollow eye effect, like the eyes literally sink in, and that means they've lost the natural fat around this eye, so the eyes have sunken, and that's sitting and reflecting. The skin on the eye, under eye area, is the thinnest in our body, right? It's thinner than a sheet of paper. So that shows that it's reflecting under the eye, and it's reflecting the muscle, which is purple in color, so it has that darkish hue. So that requires actually a filler injection. It will not correct with creams and lotion. So if there's a sunken hollow, it will not correct with creams. The fourth is a mixed step where everything is there. Pigmented type is the one that requires treatment with pigmentation lightening serums and a ceramide moisturizer, because this is the thinnest skin, right? So you have to restore that skin barrier, but also you have to suppress the pigment. And if you have it just on the upper eyelid, you can definitely use the pigment serum only on the upper eyelid. The way to apply it is take the serum, apply it on the upper eyelid, keep the eyes closed for 60 seconds, and then you can open the eyes. That's the best way to apply that. You can even get prescriptive creams to do on these areas. Now, why would you have only upper eyelid pigmentation and not the lower eye? It could be because you're not taking off your makeup or cleansing your skin properly. A lot of time, if you left your makeup on, it can cause that. And second, just the makeup that you're using could be irritating the skin on that area. And that's one. Third, it can be acanthosis that I'd spoken about, where the skin in that area has thickened. So you could have insulin resistance. So these are the top three common reasons.
Okay. We have another question, Doc, about pigmentation in the underarm area. And
Mm.
Meera wants to know if laser treatments would help pigmentation in the underarm area.
Good question, Mira. Underarm pigmentation are of two types. One is just a patchy brown pigmentation. The second one is where the skin has thickened upon itself, and that's called acanthosis. So both of these treatments will benefit from a combination of chemical peels and laser therapy. And a lot of times creams alone will not work on these. The reason is the skin is much thicker on the body than on the face. So in the face, the creams will penetrate. In the body, the penetration is not enough, and the level of activity we'll have to get in those creams would be so much higher that it's not safe. So hence, non-prescriptive care may not help with body pigmentation. So you would undergo chemical peeling and microdermabrasion on the underarm. It's called diamond tip microderm, and you would typically have a 50% glycolic acid at the clinic. It has to be done under medical supervision because it's a medical procedure, followed by like a TCA 15% peel, and then you would have fractional laser combined with a Q-switch laser, about 4 to 6 sessions to get rid of this pigment.
All right. And Nidhi has a question about the SKINQ vitamin C serum. She's asking us if the serum can be used by those who have oily skin.
Yeah. So Nidhi, yes, it can be. So our vitamin C serum actually was formulated with vitamin C ferulic acid to stabilize the vitamin C, because we use L-ascorbic acid, which is the highest, most potent form of and purest form of vitamin C. So it goes with ferulic acid, but we also added hyaluronic acid for hydrating the skin, because a lot of Indian skin tends to get irritated with vitamin C. So the hyaluronic acid is added. Plus, we've added a skin brightening agent. So it's a great photoprotective serum that can be used on a daily basis in the morning, regardless of dry or oily skin. It suits all. But I want to tell you is that the formulation takes about 20 minutes to get absorbed into your skin. So you need to wait it out for about 20 minutes for the absorption to occur.
Okay, great. So we're almost close to 8 p.m. So we'll just take two more quick questions. And for those of you who, we weren't able to address your concerns, we do have an in-house team of dermatologists at SKINQ We do have the SKINQ mirror. It's a test that's on our website as well, where you can just take a quick picture, upload your details, and there's an analysis report that you get with product recommendations. So you can always try that out as well. So just quickly coming back to the questions, Doc.
Somebody put the link of SKINQ Mirror app, because what I was going to tell you all who joined us today is thank you for joining us. But what I want to say is that if you do take the SKINQ Mirror app test, it's a selfie basically that you take. And when you take the selfie, it'll ask you to pick 2 of your high problems and it'll give you a skin quotient. It's AI-led, but our team of dermatologists will look through it for you personally, and we'll send you a recommendation of what you can do in terms of your application, and also in terms of what you could do in terms of your lifestyle habits. So if you could take the SKINQ Mirror test, we can definitely do that for you. My team and I will give you a personal analysis on your skin.
Okay. So, Doc, there's a question from Shabnam where she says that she has post-acne marks on her cheek. So what is it that she can do for her marks?
Post-acne marks on the cheeks. Okay. Post-acne marks, if your acne is gone now, this is what we call as PIH, or post-inflammatory hyperpigmentation. It's like another form of pigmentation. So definitely what I would advise you is in the morning, use the vitamin C, because you want to protect those pigment patches from getting worse. So you don't want more sun on it, and sunscreen. In the night, just use the D10 serum. And twice a week, use the D10 mask, which is the Glow Bright mask, and do this religiously for 3 months, and your acne marks will vanish for sure.
All right. And our last question for this evening is from Noor. She says that her pigmentation is 4 years old and she's tried everything that's available in the market, but nothing has worked. So she wants your suggestions on how to treat her pigmentation.
Right. So, Noor, if you've been having long-term pigmentation, right, I think one of the things is probably to check what kind of pigmentation you have. Because you could have the superficial, you could have the dermal, which is deeper, or you could have the mixed. And the treatment efficacy depends on the product and the pigmentation. And the reason we did SKINQ is because we found that there were not enough efficacious products in the market for treating Indian skin for pigmentation and acne and stuff. So I don't know what products you've used, but I would definitely tell you to use our pigment regimen. Try it out for 1 month, and come back to me. I'm happy to answer your question directly. But after you've used our pigment regimen for a month, come back to me with how your skin is feeling. And if not, then we can set up a consult for you with our dermatologist to delve deeper into its causes.
All right. Thank you, Doc, and thank you everyone for joining us this Wednesday evening. We really apologize if we couldn't take any of your questions. So like we mentioned, please do, take the SKINQ Mirror test on our website. Thank you so much for joining. It was lovely having all of you all here, and look forward to you being part of more SKINQ Talk sessions in the coming weeks. Thank you.
Thank you so much. It was an amazing session.
I'm glad you all liked it. Thank you so much.
Yeah. Thank you so much.
Thank you so much.
Yeah. Bye. Good night.